Hello, I'm Phil.
Hi, I'm Esther.
So today we're going to give a talk about how we use two specific treatments to really get fast results for people with heel pain. So Esther, the two things that we're going to talk about today is shockwave therapy, so extracorporeal shockwave, and low-level laser or MLS laser. So for people who have heel pain, often they are struggling to get better. It's a terrible, terrible problem. Generally, it's an inflammation of the plantar fascia, which is a tendon underneath, which we've done a million videos on. But today we want to specifically talk about how shockwave and laser works to help with this problem. So Esther, what is shockwave therapy?
Okay, so shockwave therapy is basically this machine that we use, and it generates electronic pulses to that area. So it helps stimulate blood flow to the tendon by breaking up any scar tissue.
Yeah. So this is only for people, you tell me if this is correct, but only for people who've had heel pain for longer than about 3 months.
That's right,
Yeah.
yes. We wouldn't want to use it on any type of acute type of conditions like...
So if I just woke up this morning and thought, I'll come see Esther for shockwave, you won't do it on that?
Absolutely.
And why is that? What would be the problem with
Because
that?
it will probably generate more inflammation and it's going to hurt a lot if we do it on an acute condition.
Yeah, it's more when the pain's been around for 3 months or more, and the tissue's actually undergone a permanent thickening and a changing.
Yeah.
The thing with shockwave is it is sending quite a high energy acoustic sound pulse into the tissue. How would you describe it? Is it painful?
It's not painful. It probably would feel a bit like a jackhammer or some sort, or like a massage gun, like a Thara gun. So, but it's just a little bit more powerful in terms of its intensity.
Yeah, the actual effect that sound wave gives, to get a bit nerdy about it, it's actually creating a cavitation force in the tissue. So it's actually sending a pulse through the tissue that you can't recreate just with your massage gun. So if you're thinking, oh, I'm gonna use my massage gun, and that may help a bit and make you feel a bit better, but it's not gonna create the same tissue changes that the shockwave will. The technology itself was developed for breaking up kidney stones several decades ago, and then it became used for tendinitises, which is or calcifications. And then they realized it actually causes a cellular effect on collagen tissues like tendons and ligaments. So it's got excellent evidence. So if you're interested in that, is it actually something that's got good research behind it? It's very good evidence for plantar heel pain and Achilles tendinopathy. But if we're talking about heel pain, it's a very, very good option for it. So if someone wants it done, the shockwave, they've got to have had heel pain for more than 3 months. And generally it's not responding to just the normal at-home stretches, exercises, icing, etc. So, Is there anyone that can't have shockwave that you can think of?
Anyone that would be having like any suspected tears in the tendon. So I generally like to send my patients for a diagnostic ultrasound just to rule out any tears before I start this treatment. But yeah,
and we can arrange all of that, so we can do that.
Yeah.
One thing I've always looked out for too is people that are on any anticoagulants or any have any conditions that may cause excessive bruising. It doesn't mean you won't do it, but we just go a little bit more gently because it is trying to reinitiate a more acute phase of the injury so that it can have another go at healing and do it properly this time.
Yeah.
So that's shockwave. We love it. We've had shockwave for like 8 years in our clinic, and it's fixed literally tens of thousands of people in Mackay with their heel pain. Now I mentioned another treatment, it's just low-level laser, which is ours an MLS laser. So tell us all about that, Esther, for heel pain.
Okay, so usually I use low-level laser to help target the cells in the tendon or the tissues to generate a faster healing response. So allowing those cells to repair quicker. And we've done other videos specifically on our laser, but it allows us to speed up your body's natural healing 2 to 3 times faster often for a lot of conditions. So now, is the laser painful? No, not at all.
Not at all? So the shockwave, a little bit?
Yeah.
But the laser, nothing?
No, nothing,
Okay. Is there any contraindications you can think of, people that shouldn't have laser?
Not that I can think of.
No, there's really none.
Yeah.
And that's one of the benefits of this therapy and these regenerative therapies that we have, is they're just helping your own body to get better quicker.
Yeah.
So if you're going to inject cortisone or do surgeries, that's very invasive. It's not that they're not appropriate sometimes, but really the therapies we're looking for is to just get your own body tissues back into a healing phase to reduce that pain.
Yeah,
So,
absolutely.
yeah. So if you've got heel pain and you want to get better quicker, we would love to help. All you've got to do, how do people get in touch with us? Esther?
So they can give us a call and speak to one of our front desk team, or you can book online as well.
Any time of the day or night for the online bookings.
Yeah.
Thank you for watching. Hopefully this has been helpful. We'll see you another time.
Bye.
Bye.